Welcome to the first episode of Health Tech Care, where I surgically combine medicine and technology to improve your health. My name is Dr. Orlando Aguila, and I hope you're having a healthy and happy day. Most of you know that I'm a chiropractor and have been helping patients live active, pain-free lives for over 10 years. But those of you who truly know me know that I have a passion for technology. So it's taken me a little while, but I'm finally merging my two passions together to be able to help more people. Most of us use technology on some form of basis every day. But when was the last time you used technology to manage your health care? Technology is part of our lives and should be a part of our health care plan. Now, I'm truly a nerd deep down inside, and I love technology and gadgets. But that's okay. I think everybody wants a nerd for a doctor.
Throughout human history, we have been dependent on machines to survive.
Okay, today we're going to be talking about the one question to ask your doctor that can save your life. That question is, what EMR do they use? Yes, EMR. EMR stands for Electronic Medical Record. It's the way your doctor can keep your health information in digital form. Now, in today's day and age, you would think that all offices use digital records. You'd be really mistaken to think that most offices use digital records. About 25% of offices use some form of digital records, but that number actually drops down to about 7% when talking about using a fully functioning electronic medical records. Yeah, most doctors' offices, the schedule is kept digital, but besides that, it's pen and paper. Now, why is it important that your doctor use an EMR? Well, it can save your life. Just think of all the interactions that occur and all the potential for errors and mistakes that happen. Over 100,000 people die every year from medical mistakes and errors from drug interactions alone. Now, that doesn't include all the other stuff that can be kept digital, like your prescriptions, interactions with other medications, even to the correct name on treatment that you're supposed to receive. So, keeping an electronic medical record can really save your life. But now, why aren't most offices using an electronic medical record today? Well, the main reason is it's expensive. The starting cost for a basic software package of an EMR is anywhere from $15,000 to $20,000 and can go up to $1 million. Yes, software that costs $1 million to implement. And that doesn't even include the hardware and the staff training that's always needed. So cost is a big factor when talking about why your doctor doesn't use an EMR. The next time you're at your doctor's office, go ahead and ask them what EMR they use. Now, you're going to catch them by surprise, trust me. Why? Because over 10 years I've been practicing, I've never been asked, not even once, what EMR I use, let alone how I manage patients' digital records, if at all. So that's the crux of the situation. One, the cost of implementing an EMR is expensive. And two, there's no really other incentive for a doctor's office to pass over into the digital form. Because let me tell you a little secret. When we send a note, a daily note, a treatment note, a services note to an insurance company, we'll get paid the same if it's on a digital record as if we send it in on paper and a crayon. So if it's expensive and patients don't care, that's the real reason that doctors aren't implementing it. Now, I'm not saying to go out and ask your doctor what EMR they're using and give them a hard time about not using one. Trust me, they probably want to be using one, but it's complicated. But simply by asking your doctor what EMR they use, you're doing your part in speeding up the process of implementation of EMRs. In 2010, it's kind of ironic that everywhere around us, technology is a part of our lives. Yet when you walk into the doctor's office, sometimes you're taking a step back into the 1980s. I think by just simply questioning, asking, and being concerned about technology in your healthcare will allow your doctor to give him a little push and maybe push the whole industry into using an electronic medical record. Thank you for taking the time to listen to our discussion today about electronic medical records. I want to thank our main sponsor, Spinal Works Chiropractic and Medical Centers, for helping us with the show. And remember, your brain's your CPU, your heart's your power supply, and your spine's your mainframe. Take care of your computer.